Okay. This is the behavioral health record date, August 30th, 2021, 3, 2, 1. Hi, everybody. Welcome to the Behavioral Corner. It's me again, hanging. That's what I do on the corner, talking to a lot of people about a lot of different things. We cover a topic called behavioral health. And as I've told you a million times, behavioral health, the decisions we make, the choices, and how all of that affects our physical, emotional, spiritual well-being. So we cover the waterfront here on the Behavioral Corner. September being National Recovery Month, we thought we would take the opportunity to broaden our view of how to get well, how to get healthy, how to get happy by going off the beaten path and looking for some other practices that people swear by have helped them, that many other people would go, well, come on, I don't think so. Anyway, that's what we're going to be doing all this month in September, alternative paths to not so much recovery, although that counts, but alternative paths to wellness, wholeness, as it were. What better topic to seize upon to do this than acupuncture? And we're grateful again to having a great guest in that regard. Dr. Carla Cassler has practiced acupuncture and Chinese medicine for over 30 years. She specializes in women's health, pediatrics, orthopedic, and trauma treatment, which is really what we're going to focus on here today, I think. She has been for the past 6 years the associate director, I believe, of a group called Acupuncturists Without Borders. So, like I say, you hang on the corner long enough, great people show up. Dr. Cassler, thanks for joining us.
Happy to be here.
So let me begin at the beginning. How did you get involved? Why did you choose acupuncture as your field?
Well, I lived in New York City in my 20s, and I wanted to be a surgeon. So I was on my way to medical school, as they say. I was earning money as a paramedic in New York City, and I got my massage therapy license to earn money so that I could go to medical school. And in the course of my work in the community clinic that I worked out of as a paramedic, I worked with a physician, an MD, who had learned acupuncture for drug addiction treatment in the South Bronx at Lincoln Hospital. And she brought the practice of acupuncture into our clinic, not just to treat our patients who had substance dependence issues, but people who had pain, different kinds of diseases. And when I saw the results of acupuncture with our patients, who were very challenging patients, high-risk patients, people who had a lot of different problems, I knew that Chinese medicine was what I wanted to pursue versus surgery. And so I started on the quest to learn acupuncture. That was in the 70s. It was not yet something that you could study in a school in the United States. You had to be an MD, and like my colleague was. So I actually moved to California in the late 70s because there was actually a state certified apprentice program where you could apprentice with acupuncturists who had immigrated from Asia and were living in the United States. And that's really how I started my career apprenticing. And then eventually there were some schools set up, and I went to one of the early ones in San Francisco. And that was actually 37 years ago.
Yeah. Well, I certainly can understand you having to go to California to find out about something that would be a leading edge, because we know California, particularly Northern California, is usually a step or two ahead of the rest of us. But I guess also the Asian influence on the West Coast was a huge factor. So let's begin at the beginning, because I get sort of paid to ask the dumb questions. Most of us who have any knowledge, however minor, about acupuncture, and correct me if you think I'm wrong, associated with, well, it'll help my back pain.
Right.
It'll help my migraine headaches. In other words, they're trying to get some physical relief from this.
Yes.
So let's begin there and tell us, if you can, in lay terms, what you're doing with all those needles, and how it works.
Well, first, I just want to go back to what I said about my first exposure to acupuncture, because it was really through the drug detox world, or drug detoxification efforts of doctors in the West. that acupuncture came from Asia to the Western Hemisphere through Montreal. The doctors in Montreal at McGill University first started using it. And then community activists and physicians who were at Lincoln Hospital in New York City in the South Bronx, where there was a tremendous, we think of the opioid epidemic now, but in the 70s, it was a huge opioid epidemic, primarily heroin in communities of color. And so a number of the activists who used the services of Lincoln Hospital included the Young Lords, Puerto Rican community activists, and Black Panthers, learned about acupuncture being used in Montreal for drug addiction as a replacement for methadone treatment of heroin addiction. And so they went to Montreal, they went to China, they really actually brought the practice back.
Wow.
At a community level. So acupuncture did not come to the West as a pain control treatment. It came as a drug dependence treatment, as an alternative to opioids. And we use that today. We use it for that today. So that kind of segues into your question.
Wow, that's just an amazing story. So
it is an amazing story.
Turns out the Panthers were reading more about Asian life than Chairman Mao's Little Red Book.
Oh, yeah. Yeah.
Why? Okay, so, yeah, I'm sorry, go ahead.
Well, I was just going to say that Mao Tse-tung himself was not an advocate of acupuncture. He wanted to westernize medicine in China, and he was thwarted by the fact that there were just too many people. So,
right.
No, seriously. And so there were a lot of the doctors who trained me, who were acupuncturists from China, were imprisoned during the Cultural Revolution, during that time when Mao was trying to get rid of Chinese medicine as it was traditionally practiced. They immigrated to the United States, many of them, and became our teachers in the early years of acupuncture training. But then pragmatically, he had to come back to some version of acupuncture and primary care medicine because there were just too many people in China. And that's when the barefoot doctor system started. So actually, that was also part of that Black Panther Young Lord exposure, was seeing acupuncture as people's medicine, okay? As medicine that could be practiced in communities and benefit the community depending on their challenges, whether it was pain, poverty, drug addiction. So,
and when you say in the community, you mean in the community.
In the community.
Pardon me, as close to the problem as you could get.
That's right, in the community.
And, all right, good. I just want to reframe my question then. What was it that those Canadian, I guess you said Canadian doctors and researchers saw in acupuncture that led them to believe it might help substance abuse? What was it?
Because many of the now we're going to get into the physiology piece.
Yes.
Acupuncture is a very regulatory treatment. And what I mean by that word is it's a very physically regulatory treatment. It involves stimulating the body's own chemistry, okay, to reset and regulate. Okay. So when you're dealing with things like substance use or substance abuse or dependence and things like pain, you're trying to regulate the body chemistry and particularly the brain, okay, the brain chemistry. You're trying to help the neural pathways that are involved in pain and substance dependence. Often they're shared pathways on the neural level. And so acupuncture helps the body produce chemicals that essentially replace, for example, the chemicals that you're ingesting as a drug that you're addicted to. In a sense, the acupuncture helps stimulate the brain to produce its own chemicals to work with the receptors in the brain that the drug is meeting with. And instead, the chemistry from the person's own body is hooking up with the receptors. And so that changes the need for the drug in the body. The body is essentially producing its own endorphins and other chemicals to replace the drug. And so this is how it works with drug dependence, and also with pain. because essentially what you're trying to do is help the body produce its own opioids or its own endorphins in order to control pain. And so you can use acupuncture not only to work with withdrawal, for example, from drug dependence, but also to work with pain prevention so that you don't have to go on drugs in the first place if you're going to use drugs for pain. Does that make sense?
Well, it perfectly summarizes the difference between the West and the East with regard to this, because both things that you describe as problematic, substance abuse or pain, in the West, the traditional means is to fight the drug imbalance in the body that's causing the pain or the substance abuse with other drugs.
Right.
And acupuncture said, well, no, there's a way you can do that without using drugs.
Right, exactly. So
which
that's,
would
again,
certainly, I'm sorry.
No, I was just going to say that's exactly the instance with using acupuncture instead of methadone for heroin addiction.
Exactly. You could see why people who were intimately familiar with substance abuse and saw those methadone clinics putting people into a stupor and zombie-like behavior, saying, is there some better way to do this?
Right. And just to answer your question a little more specifically, the doctors in Quebec and the ones at Lincoln Detox, I mean, they were thinking not just about, they were looking at research from China that was being produced and translated about things like pain control and using acupuncture as an anesthetic tool for surgeries and things like that, where you're literally creating numbness in parts of the body for surgery procedures. And if you can do that with acupuncture, they extrapolated very quickly. You can do a lot in terms of changing the body's need for a drug or preventing pain. The first time I ever saw, in 1972, I went to University of Vermont and I saw a film from China that had been brought back after Nixon went to China and opened it up. And I don't know if you're probably old enough to know this, or young enough to know this, but James Reston, who was
I was just about to remind you of that.
He was editor of the New York Times, and he got appendicitis in China when he was with Nixon, and he had acupuncture after his appendectomy. So then that kind of opened up the entire on the media level, and I saw this red China kind of propaganda film about acupuncture, which could not have been edited with computers because they actually really didn't exist at that level at that time in terms of Photoshop and so forth, where literally people were getting brain surgery. I think I saw a C-section, some other kind of abdominal surgery where the person was awake during the procedure, literally at the end of the sew up at the end, the surgeon, that person would kind of sit up and bow to the doctor. I mean, there's no way they could fake it. So that's how powerful acupuncture is in terms of mediating the neural pathway communication for pain. And so the doctors in Montreal knew this. Well,
I certainly remember the Scotty Reston piece. It electrified people who read it, going, "This is no nutty guy." He said it was a miracle. All right. Well, so let's talk about this then. I mean, I think I can understand if I think of the body as a network of highways, and instead of cars, it's electrical impulses that are running back and forth. And if you burn your foot, it sends a message to your brain that hurts. So acupuncture gets in the middle of that process.
Yes.
My question is, first of all, the message to the brain that you're hurting is uncomfortable and awful, but it's also important.
Right.
If you didn't feel pain, you'd be in trouble.
Right.
Okay.
True.
So what's happening when an acupuncturist locates the spot where they intercede? What happens? Where does the message go? In other words, is it what happens there?
We don't know everything about the scientific answer to that question, but here's some of the things we do know. First of all, we can see that acupuncture works. We see the result, and that's true with most medicine. People think it's that scientific medicine is the cat's meow, and it is. I mean, like I said, I wanted to be a surgeon, and I like Western medicine when it's practiced well and for the right reasons and the right items. But we have like a very long clinical archived history of acupuncture practice that dates back at least 2,000 years. The Chinese cataloged a lot of the medical practice, and not just acupuncture, things like herbal medicine, for example, and different kinds of physical manipulation techniques and dietary and all that stuff, because the Chinese never burned their libraries like the Westerners did, like the Greeks. Like the books that we learn from still are 2,000 years old. I mean, that's not all we learn from as acupuncturists, but they're included. So we have a long empirical clinical history, and then modern research has been able to show us a lot, and especially in the age of imaging and thermographic photography and MRIs and all of that. Military medicine has actually helped us a lot see what happens in the body when acupuncture needles are placed in the body. So what we do know is that when you put needles into the tissue, we think that the impulse that is stimulated runs through the connective tissue of the body. And the connective tissue is like the big netting that connects everything. You know, it's almost like gauze, and it connects everything in the body. Okay. So, and we can see this through thermographic photography at a micro level, where you put the needle into the fascia or the connective tissue, and you start seeing the temperature spread, that it changes and it spreads like putting a pebble in a pool. Okay. This is what makes sense scientifically, because we also know that acupuncture stimulates. If you put acupuncture needles into a point on the foot, for example, it can affect the head. Okay. So this is how we know that the conduction, the electrical conduction, which is seen through this thermographic photography, is happening on the connective tissue or the fascial plane, because the fascia runs from the foot to the head.
Yeah. We're a closed system, right?
Right. And actually, you know, clinically, things that needles you put in far away from the place of injury actually often work better. Okay.
Really?
So if you have back pain, often you work on the lower body and the feet below the knees for the best results, not just on the back itself. So we know that acupuncture is very regulatory on an electromagnetic level, and we are electromagnetic beings. You know, we're chemical and all that, but at the more atomic level, it's really conduction of electricity, okay, through chemistry. And so we can see that a lot of regulation happens when the electromagnetic energy is engaged. A lot of things, a lot of functions in the body reset and regulate. So you can see that the brain chemistry, for example, like the flow of blood in your brain equalizes with acupuncture needles in the body. Okay, so the blood circulates better to your hands and feet. That means at the cellular level, okay, you're getting better blood flow to the cellular level, and you're getting good uptake of all the toxic metabolic materials that are produced by the cells. And this is actually how acupuncture helps work with things like inflammation, okay, or pain, because you're bringing good, new, nutritious blood to the cell, and you're taking away all the waste products. So, you know, it's not so much, acupuncture can be used for numbing, okay, but that's not so much what we're doing with pain control. It's more about improving circulation, okay, de-inflaming an area. And the other part is regulating the nervous system, so that those neural pathways that are sending the message to your brain about this hurts, this hurts, this hurts, that there's an intervention there, so that the brain can, so that information communication can actually cut off and be more selective once the tissue itself is healed. A lot of chronic pain is not because the injury didn't heal, it's because the nervous system hasn't turned off the message yet.
Ah, that's fascinating. I guess it explains to a certain degree why different people have different thresholds of pain. Some
Yes.
people seem to be able to regulate their feelings anyway, their discomfort, while others,
Yes.
Everything hurts them.
Right.
That's interesting. The more you learn about something esoteric or off the beaten path, the more often it seems less like magic than common sense. It sort of makes sense. Let's move to some of the other things, because I think you painted a great picture on how acupuncture treats us physiologically. With regard to things like substance abuse or mood disorders, is the process the same? Is the same effect being achieved?
Well, that's again more the case where the body is being stimulated by the acupuncture needles to produce their own morphine-like chemicals, okay, and also to again normalize the brain function. Mood disorders are very interesting because as a behavioral health person, it's a more how would I say it? It's more of a comprehensive, or it's a confluence of factors that are creating often what we would call a mood disorder in the West. In Chinese medicine, we call it a spirit disorder, which is interesting, or spirit, a dysregulation of the spirit. Okay, that's the traditional way of describing it, and in a way, it's a better way because spirit is kind of a bigger word or a bigger concept. It can include the emotional. It can include what we call the spiritual and the mental. And, again, in Chinese medicine, the physiology and the spirit body, so to speak, are not separate. It's all one thing. We don't have, you can treat what we in the West classify as mental disorders or mood disorders with acupuncture points, but that is not the perspective of the acupuncturist who's trained traditionally. It's more about, again, regulating the spirit body. And it includes physiological balancing and chemical balancing of the brain. And I would also say, and this kind of takes us more into the trauma realm, it's not just the brain, it's also a lot about the heart. Okay. And when I say heart, I'm using the word heart with a capital H. It's not just the cardiac organ. It's the connection between the heart, the brain, and the emotional processing that happens in that physiology that is can be transformed in certain ways by acupuncture, especially if there's some kind of traumatic experience where the traumatic memory is retained by the person in the body. Trauma is retained in the body. It's not just a psychological thing. It's a physically based issue.
Our guest is Dr. Carla Cassler. As you can tell, Dr. Cassler knows a lot about acupuncture and Chinese medicine. She's been doing it for over 30 years. It's fascinating when you talk about that. And I think I know what you mean by the heart. Anybody who's ever bought a greeting card on Mother's Day knows what that heart means. Yeah. And the spirit connection certainly makes sense. We know, though, in the West, we're now, at least now, out of the realm of thinking of substance abuse, alcoholism, or drug use as a character flaw, and more as a disease of the brain.
Right.
Your brain is literally rewired.
Yes. Yes.
So have you had the occasion of treating people who were substance abusers with acupuncture yourself?
Oh, yes. And also, just for people's information, if you go to most, at least, urban area public health departments where there is like daily drug treatment, acupuncture is usually part of the offering. because it has a much better lower recidivism rate in terms of a therapy than a lot of other treatments.
Yeah.
And it's actually quite practical because we use acupuncture we can use acupuncture in a community setting, meaning like literally if you're sitting in a waiting room or in a group setting, and we do acupuncture in the ears, okay? That's it. You don't have to do more because you can access that brain chemistry through the points on the ears. You can treat the entire body on the ears. And so ear acupuncture, which is really, again, what they developed at the South Bronx all those years ago, is very practically offered. It's cheap, it's safe, you can do it every day. There's schedules where you do it every day. There's a whole protocol of how you get people off of drugs and medications. We use it for regular medication use too. Like if you have, many people take like 15 drugs, and don't tell me anyone knows what's happening chemically in that person's body. No doctor knows. There's too many synergistic effects that we don't understand when there's that many drugs in in the cocktail of the person. So a lot of times people come for acupuncture just to like pare down their drug regimen, like so that they're taking 6 instead of 15. And
it's interesting. It's always been interesting to watch elderly people. If you have parents that are elderly, drugs prescribed endlessly to lengthen their lives, and then as they get to the furthest ends of that, even the doctors start saying, okay, get these drugs out of here, stop that. Let me ask you about the substance abuse piece though for a moment. It's necessary for the person who's going to have acupuncture for their substance abuse issue that they be detoxed before acupuncture, or does acupuncture help detox them?
Yeah, no, acupuncture is a primary part of the detox. Okay, because again, you're taking somebody with a drug that's physiologically dependent on the drug, and with the acupuncture, you're changing the chemistry to essentially create a different kind of scaffolding for the person chemically as you take away the drug. You don't just take the drug away and go into like cold turkey. That's the whole idea. You actually it's kind of like gently descending down from the drug into the non-use of the drug. That's the beauty of acupuncture, and that's why you use it every day when you're doing a real drug detox process.
Does that work the same with? I know that there's a difference between detoxing from heroin, for instance, than there is alcohol. Alcohol is a much more dangerous drug to rid yourself of. Does acupuncture work the same way with someone with alcohol abuse?
But yes, but you would always use it in concert with. I mean, the ideal is to use it in concert with the biomedical doctor who's perhaps giving somebody anti-abuse or some other kind of drug as they're detoxing off of alcohol. So, I think that that's the best use of something like acupuncture in this situation, but you can use, I mean, my organization, for example, Acupuncturists Without Borders, one of the places that we've worked historically is Mongolia. And you're thinking, why Mongolia? Mongolia has one of the highest alcoholism rates in the world, and it has the highest liver cirrhosis and liver cancer rate in the world. Okay. People are addicted to alcohol there, like in a very strong way. And it has to do with the occupation of the country by the Russians and vodka. And the reason for it is big. And then, clash of nomadic culture and modern culture and no employment and so forth. So we've trained a number of the alcohol, what are they called? They're called alcohologists. Okay. They're literally doctors who work in the mental health department of Mongolia who treat alcoholism because it's so rampant. And we've trained them to do the ear acupuncture for withdrawal. So it's a very commonly used therapy for alcohol addiction.
A couple of nuts and bolts questions. How deeply into the body do the needles go?
That's a good question. So for ear acupuncture, which is what we're using in this detox situation, the needles the needles go in maybe 1 millimeter. Okay. And if people are interested in this, they should go onto the website of NADA, NADA, the National Association for Acupuncture Detoxification. Okay. This is the organization that was created over 30 years ago that came out of the Lincoln Detox distillation of the ear acupuncture protocol that we use. So this is the organization NADA, and you can see a lot of research on drug dependence and the use of this ear acupuncture protocol. And the protocol itself is called NADA protocol. So there's the organization NADA, and the NADA protocol is what we acupuncturists refer to as the primary ear acupuncture protocol that we use in drug detox treatment. There's lots of other acupuncture points in the ear. So for example, you may be addicted to a substance and you may also have knee pain or back pain. You can always add other points to the ear treatment along with the basic detox treatment for help with that area of your body that's in pain. And the other thing is pain, trauma, and drug dependence are interactive. They're interdynamic. If you have a lot of pain and you have PTSD, typically your PTSD symptoms will increase if that pain is not controlled, and vice versa. People with a lot of trauma background have higher levels of pain. And so what I love about acupuncture is that it treats all three. Okay. One type of treatment can treat trauma, dependence, and pain. It's not like you have to have 50 treatments for those three different things. And
well, that begs the question of why it is not more readily adopted, not only by everybody in the West, but specifically the insurance companies. What's the situation with insurance and acupuncture?
Well, oddly enough, insurance has been much more forward than the rest of the medical system in terms of adopting acupuncture as something that they cover because it's cheaper. If you look at the cost analysis of treating someone with back pain, especially through surgery, drugs with acupuncture, I mean, people have done these studies. It's much cheaper, much safer. Okay. And so the insurance companies are actually often willing to cover. Right now, we've finally gotten acupuncture into the VA, which is the largest medical system in the country. Okay. The Veterans Administration. And again, I think I referred to this before. Military medicine has really helped us get acupuncture more into the mainstream because so many of the soldiers that were coming back from our wars in Iraq and Afghanistan, not this week, but in the mid 2000s, the PTSD treatments, there were no good treatments. A lot of people got addicted to opioids because that's what they were given for post-traumatic stress. And it's really the military medicine system was interested in alternative treatments because biomedical treatments weren't helping very much. Okay, so now and they have the resources and the ability to do good studies where they could use things like MRIs to take pictures of people's brains while before acupuncture and after to see what happened in the brain. And from all of that research, finally, acupuncture got vetted as a useful therapy. It's now offered in the VA. People like me can do acupuncture on veterans outside of the VA system if it's in a place where there's actually no acupuncturist working. So the next big frontier in terms of getting acupuncture into the mainstream of medicine is Medicare. And it will probably happen soon. Again, cheaper, okay? Effective, especially for older people who have pain, can't have surgery, okay? Because the anesthesia will hurt them. many elder people actually go to acupuncture because other things haven't worked. So elders are a good source of experience in terms of acupuncture. In fact, my grandmother was one of the first people I knew who ever got acupuncture. And so it will change. It's changing in medical school training. That's the other part of this. Heretofore, a lot of doctors would go, oh, it's, voodoo. It's like,
Yep.
But that's not true now. Most medical schools offer some training, at least in a cursory way, to their physicians and nurses that includes alternative medicine, what is called alternative medicine training. It doesn't mean that they know how to do it. It means that they may be able to triage better, though. Like they may be able to say to their patient, okay, your back pain isn't getting better through physical therapy. Also go to acupuncture and let's see if that helps you.
I see. Well,
okay.
You know what? I can see in the 30 years you've been doing this, that there's been a lot more changes.
Yes. Yeah.
Positive changes than I would have thought. Dr. Cassler, we're running out of time here. I did want to mention Acupuncturists Without Borders. I know you do a lot of great work, and as you said, real grassroots efforts, places like Haiti, tragic Haiti. We were talking about this at dinner the other night. What exactly has Haiti ever done to deserve the woes they keep getting pounded with? I know you were recently there. You've been many places. Your group is going to have some webinars coming up on a couple of different topics.
We have lots of webinars. You can go to our website, which is acuwithoutborders.org. Okay. Acu is not spelled with 2 C's. A lot of people spell acupuncture incorrectly. It's ACU without borders.org. And you can see what we do. And there's lots of interesting webinars. One in particular, I will point you to upcoming, probably October, maybe November, is alternatives to opioids. Okay. Again, acupuncture is a great way to get pain relief without going onto the opioid road. So this is especially for people who may be practitioners or mental health practitioners who are interested in learning more about how acupuncture can be a useful adjunct to, talk therapy or traditional psychotherapy. We love that combination. Works great.
Yeah.
This would be useful. And then you can also see the work that we do in the world. Right now I live in California. We have wildfires. All the first responders are not sleeping because they're up 24/7. We give them ear acupuncture, and it's like, a half an hour ear acupuncture treatment's like sleeping 8 hours. So that's a whole different application of our treatment to help people be able to function in ways that they have to. So.
Well, it's amazing. I'm so grateful for some mutual acquaintances that we have that put us together here, because they said you were the best to talk about this. Dr. Carla Cassler has been with us talking about just another of our looks at alternative paths to wellness. And all we ask of these shows is that, you willingly suspend your disbelief, keep your mind a little bit open, and you may find out some very interesting things. Carla, thanks so much. It's been a real delight. I'd love to have you. I know you're very busy. I will circle back at some point and do this again real soon.
Great. Thanks so much, Steve.
Pleasure. Thank you all for hanging. Don't forget, follow us, Facebook, Instagram, all that stuff. And you might even write a little review if you like it. We appreciate that as well. Behavioral Corner. Take care next time. Bye-bye. Well, Doc, that was